Ma'am, we are live now. You can start. Thank you.
Thank you, ma'am. Pallavi, ma'am, thank you for the cooperation.
Yes, ma'am.
Start.
Right. So, a very good afternoon to everyone, and a very good morning to anyone who's joining from US like me. So, I'm Dr. Sanat. I'm a house surgeon from Karnataka Institute of Medical Science, Hubli, and I am also the National Vice President for International Fraternity of Medical Students. So, International Fraternity for Medical Students is an organization that was started in 2019 by our founder, Dr. Saad Khan and Dr. Saima Afzan. From being a Hamdard Institute of Medical Science and Research Center and Delhi-centric organization, IFMS has now spread over to 17 countries and 22 states across India. Our motto, Connecting Minds, Nurturing Growth, reflects our compelling vision and indestructible desire to grow as individuals. We believe that knowledge is limitless and cannot be caged in books. Gaining practical knowledge about medicine and understanding values like compassion, humility, and humanity is what contributes towards the holistic development of a doctor. Our ambition is to help people grow to their full potential by providing them with the best knowledge, along with encouraging them to become leaders in tomorrow's highly competitive world. Now, it gives me great honor to introduce our speaker for today, Dr. Piali Bhattacharya, ma'am. Ma'am did her MBBS from Bankura Sammilani Medical College, University of Calcutta, and she did her post-graduation DCH and MD Pediatrics from King George Medical College, Lucknow, Uttar Pradesh. She has been awarded Fellowship of Indian Academy of Pediatrics in 2015 and the Fellowship of Royal College of Physicians, London in 2019. Ma'am is now a consultant pediatrician at Sanjay Gandhi Postgraduate Institute of Medical Science, Lucknow. Ma'am has also been authors of various research articles in various international journals and also is author of more than 27 book chapters. Ma'am is also a member of the National Advisory Board Journal Indian Pediatrics 2017 and member of the advisory board Child Today, a journal of UPIAP 2018. Ma'am has also constantly won awards in UPIAP 32nd to 37th and 39th Pedicon conference. And she's also the national winner, the Jagran Awards for Excellence in the Field of Social Services 2015. It's an honor to have you as our speaker today, ma'am. Thank you for joining us. Now, I would like to introduce our WPF and International Adolescent Health Week coordinator, Dr. Preeti ma'am. Dr. Preeti ma'am is a strong advocate of child and adolescent holistic healthcare for 3 decades. She believes in enhancing health in all its dimensions: physical, psychological, emotional, digital, spiritual, and social. Ma'am did her MBBS from Lady Hardinge Medical College, Delhi, and MD Pediatrics from BJ Medical College, Pune, and postgraduate diploma in adolescent health from University of Kerala. Dr. Preeti ma'am is a trailblazer and pioneer in the field of adolescent healthcare in India. She's an integral part of IAP that revolutionized adolescent healthcare. She is the recipient of many awards, including the a Fellow of Indian Academy of Pediatrics Award, Karnataka Women's Achievers Award, and the SAHM Northern Hemisphere Award. So now I would like to hand over to Dr. Preeti ma'am for the further meeting process. Yeah, thank you.
Thank you so much, Sanat. It's a pleasure to be here today. It's a special day today because it's the last day of the International Adolescent Health Week. As you all know, we have been celebrating International Adolescent Health Week over the last week from 7th to 13th October. And I can say for India, this is the grand finale. What better than to spend this day learning basic life support to save lives, which is the primary aim of a doctor. And I love the certain words which Sanath used regarding International Fraternity of Medical Students, connection, nurturing, humane. Thank you very much for making us think about these very important components of life every day. And to tell you a little bit about International Adolescent Health Week, it started way back in 2016 by Dr. Laura Offert, who is a physician in Pennsylvania. It started as a Pennsylvania Teen Week and went on to become the International Adolescent Health Week, which we all are celebrating today. And its main aim is to do programs by the youth, for the youth, and of the youth. We totally believe in meaningful youth engagement. We believe in partnering with the youth so that they can reach their potential and, in the right words, not only survive but thrive. Building adolescents' resilience is what is the theme for International Adolescent Health Week. Now, to tell you a little bit about BLS, why is it so interesting? I was going through some data from India, and to my surprise, I found that 96% of young doctors actually attend a course of BLS, but when it comes to assessment of the quality, only 50% really are up to it. And when it comes to the youth school students, only 38% of them have somewhat heard about BLS, but 90% of them are wanting to learn BLS. So I hope today that not only we revise BLS so that we as healthcare professionals become stronger in it, but we are also able to motivate the youth to adopt it, because if we do the correct CPR, the chances of survival are increased by 2 to 4 times. So here we go to tell and invite Dr. Sangita Lodha, who is the backbone of Women Pediatrician Forum. And as I invite her to speak, I would also introduce a very special guest, and that is Mr. Yashwant. He's the International Adolescent Health Week Youth Ambassador. He has been chosen from over 90 applicants from India, and over the last 1 week, he has been really speaking up for the youth of the country. And Yashwant is a 4th-year BMS engineering student from Bangalore. Welcome, Yashwant, and we'll be talking to you about a little bit more about BLS after Dr. Pyali's session. Over to you, Sangita, to tell us a little bit about WPF.
Yeah. Thank you very much for making this BLS something about the Women Pediatricians Forum. I am Chairperson Dr. Sangita Lodha, and our vision as a team is multifold, and every member is relentlessly working towards it, striving to give our 100%. Apart from our academic activities, we focus on issues related to girls and impact of our projects on the society at large. We work to empower adolescent girls and boys both and challenges they face, create awareness among them on issues like female feticide, abuse, and neglect of child rights. As part of our development, we address issues specifically related to women pediatricians' legal problems as well. Our vision is to enhance and encourage representation of women pediatricians in various panels and groups which decide on girl children, adolescent-related issues. Meetings and participation in forum activities will develop, I think, a very good platform for all the ladies pediatrician as well as. And thanks once again to just make this BLS as a part of Women Pediatricians Forum. Thank you. And the stage is yours.
Thank you. Thank you, Dr. Sangita. I must also mention that the Women's Pediatrician Forum has recently started a youth editorial board, and Dr. Sanath is a part of that. So we really mean what we do and what we say. We really mean in meaningfully engaging with the youth. So over to you, Sanath, for the rest of the proceedings.
Yes. Thank you, Dr. Preeti ma'am and Dr. Sangita ma'am. Now, without further ado, I would like to hand it over to Dr. Pyali ma'am. Pyali ma'am, over to you.
So I will start sharing my screen.
Yes, ma'am.
So welcome one and all to this session on essential life-saving skills. As Dr. Preeti has already told you, I would just want all of you to close your eyes and just think of one of your friends lying on the ground close to you. You are feeling a cold, clammy skin when you touch him. How would you feel? Wouldn't you feel that, could I have done something for my friend out there who's cold and clammy? Could I bring him back into a normal state of life? So then, as you deliver basic life support, your friend comes back to life, and think of the huge satisfaction, of the joy of having this friend back with you. So having said that, this is an emotion of saving lives which no other emotion will be able to beat. So having said that, let us first understand what actually the CPR means. CPR means cardiopulmonary resuscitation, and it is actually a life-saving technique. It can save lives in adults, it can save lives in children, it can save life in infants who have stopped or have no heartbeat and no breathing. And it involves, like I will tell you later on, 2 or 3 things like chest compressions and breathing, rescue breathing, so that you pump the blood and oxygen through the body. Basically, the goal is to keep the vital organs perfused, of which I will show you in my video as well. And BLS involves the basic life support, which is the A instead of the Z. So if you don't know your A, B, C, you will never know your X, Y, Z. Every 5 years, this is a science, remember, and an art too. So every 5 years, the American Heart Association releases further guidelines about the BLS and CPR, which we adopt, retrain ourselves every 5 years. So I would advise you to be in touch. To 2025 again, there are going to be some guidelines which are going to come in, and I would advise all of you to go through those guidelines. Like Preeti was quoting, there's a lack of CPR awareness. And this came out in Indian Express a few years back, that less than 2% were aware of CPR. And per lakh population, only 4,200 were getting some amount of care after they were getting some arrest. And every minute, 112 people, not only old ones, I will tell you, as young as 16, 18, 24, are succumbing to cardiac arrest. So, who needs CPR? Any person who has had a sudden cardiac arrest will need a CPR. So, when a person becomes unconscious and unresponsive, when a person stops breathing or is fighting for breath, gasping, and the person does not have a pulse, the person may need a basic life support, a CPR. When there's a sudden cardiac arrest in adults, you have to understand it is different. The causes are totally different from that in children. So in adolescents, it's not a cardiac arrest, which is the major cause. It is a respiration problem that has caused this cardiac arrest. So basically, we target more of respiratory support. And once we have actually managed the respiratory part, the cardiac part automatically follows. Whereas in adults, it is often due to cardiac causes. So, if the CPR is administered, supposing a person falls beside you, and you can give the CPR right there. Many of you have heard about CPR in planes, where they have advertised asking for a doctor, and a doctor has gone and saved the victim. There is always a better chance of recovery. And majority of the cardiac arrests are at home and witnessed in about 85%. Had timely effort been made, if you remember Dr. Abdul Kalam Azad, we may have been able to save those people. But none of the people surrounding him could manage to give him a CPR. Again, it should be initiated immediately. And every minute of delay that you make, the chances of mortality increase by 17%. So when we say steps of CPR, let us start with adult CPR first. So I will just show you a essential video first.
Really, there's no sound?
Yeah.
There's no sound.
Oh. So just watch and I'll
Okay.
see what can be done with the song.
Okay.
Okay.
You can see over here, as the compressions take place, the heart is actually, we are the artificial heart who is pumping the blood onwards to the brain, to the kidneys, to the vital organs. So once you've seen that, first and foremost is that you should verify scene safety. I mean, if it is a fire burning and there's a person who has had a carbon monoxide inhalation has fallen down over there, it does not mean that you jump into the fire to save. Let the firefighters bring the person out. Or if there has been an automobile accident in the middle of the road, you don't need to step in the middle of the road and get a accident yourself. So verify the scene safety. And then first and foremost thing is that you tap the shoulders as in the photograph over here lightly and you ask, are you okay? Or how are you? Or do you need some help? So once you've tapped lightly and the person does not respond, only then you will activate the emergency response system and get an AED. You will get also call on, everybody has a mobile and their mobile phone in their pocket. So you can call in India 112, 108 and internationally you can call 911 as applicable. And you can ask one of the bystanders for help to get in. If it is specifically in an airport, in a railway station, you have those glass cases where there's an AED there. You can break the glass, bring the AED and set up the defib. Next, once you've asked if the person is okay, you have activated the emergency response system, you check for breathing. Look, listen and feel. Three things that you need to do. You need to look for chest rise, you need to listen for breathing, and you need to feel the pulses. So the pulses, what pulses? If it is an adult, you look for the carotid pulse. So you put your fingers on the trachea and then you slide down to the groove beneath and there you can find the carotid pulse going. If you do not take too much time for a pulse check, remember we give only 10 seconds for all this. So you are going to start your CPR. If you have taken too much of time, you are losing 70% more mortality every minute that you lose. So remember, you must do it very, very fast. So you've checked for breathing, you've checked for pulse. Now, there are three things which can happen. The first thing is breathing is normal and the pulse is present. So this person has a greater chance of survival. You monitor the victim, and this victim, you called 911 or 108, and the person should be transported to the hospital immediately. Second situation that would arise is if no breathing at all, but hopefully the pulse is present. So such a patient, you just assist in breathing and provide rescue breaths. That means what do? You pinch the nose. You can guard yourself by putting a handkerchief or a gauze piece or a breathing mask on the face of the person, and then you count from 2006, 2005, 2004, 2003, 2002, 2001, whoosh for a second. And then again, 6, 5, 4, 3, 2, 1, and whoosh for a second. So what you must remember is that you do not actually fill yourself with air and push it in. That can cause trauma. So as much air that your cheeks can accommodate, that would be enough to give a rescue breath. That's it. So the third situation which may arise is if there is no breathing, there is no pulse, what will you do? This is the place where you will start high quality CPR in the sequence compression, airway, breathing. So this is the rescue breathing. You tilt the head with one arm and you tilt the chin with one arm, lift the chin, and then pinch the nose in an adult and give rescue breaths. Watch for chest rise. So look, listen and feel over here again. And in between the two breaths, raise your mouth so that exhalation of carbon dioxide is possible. Now, once you've done that, position yourself at the victim's side. Place the victim on a flat, firm surface. See, in India, it is very difficult. If you lay him down on the ground, the patients will come and say, Ki, before death only you have made him die. So instead of that, what we do is we put a wooden plank underneath the patient on the bed itself so that we don't lose the effort of doing a CPR. But if you have a proper hard surface, it will be always better so that your effort of CPR is not lost. So place the victim on a flat surface, kneel down with your knees beside the victim and place the heel of your dominant hand. So what you do is, this right hand is most dominant in most of the people. So you put this heel of the hand where intermammary line is traced. So once you trace the intermammary line, just below that on the sternum or the chest bone, you place the heel of your dominant hand. And then once you've put that, you hold it with the other hand. No part of your hand other than the heel actually touches the victim. So once you've done that, now you can start the CPR. So what? Straighten your arms and position your shoulders on the chest. So this again is a position which you must adopt. Your thighs and your legs should be at right angles to each other, and your arms should be straight, not bending at the elbows. You can watch the position here that the person has taken. He is thrusting from the chest, and this hip is at perpendiculars to the heel. So once high quality CPR, the cycle of compression and breaths will be 30:2, starting with C, chest compressions, A, airway maintenance, and B. So if you are alone, then you will have to sort of circle in the breathing part and the compression part. But if there are two of you, a sort of a coordination has to be established so that once 30 compressions have been given by the compressor, immediately the other person takes over and gives 2 breaths. So 30:2 is the ratio, and CAB, say compression, airway and breathing, is how you do it. So remember, A is also very, very important, because if you are pushing in air and the neck is flexed or the neck is hyperextended, you will not be able to reach the lungs. So whatever goes in will come back. So remember, head tilt, chin lift is how you hold the patient's head. So you put one hand on the forehead and you tilt it a little, you put another hand on the chin and you lift it a little, and then you give the breaths. Now, if you've done, any one of you have done a BLS, you understand how difficult it is on a living man's chest, just being there and pushing up to a depth of 5 to 6 centimeters. So it takes a lot of push hard and push fast. That is at the rate of around 100 to 120 per minute. So what you will have to do is, we actually practiced it on our pillows by looking at the watch and counting the rate, whether it was 1, 2, 3, 4, like that, till 100 to 120 per minute thrusts were attained. So deliver compressions in a smooth manner. You don't jerk the patient all the time, or you don't bounce on the patient all the time. And allow complete chest recoil. So you've pushed in about 5-6 centimeters. You needed to recoil another 5-6 centimeters and then again push in to get the full volume space inside the chest. So don't just actually lean on the chest all the time. You allow it to recoil as well. These are the small nuances which give you a very high quality CPR. Now remember, minimize interruptions. It is difficult, very, very difficult to have 5 cycles of this 30:2. And then if you don't have a change, if you don't have another person helping you, you tend to sort of fatigue, and then thereafter your compressions become less effective. So if you are two rescuer, it will be very helpful for you. So minimize interruptions, and remember, count out loud 1, 2, 3, 4, so that the other person knows when to deliver this and how many cycles have been completed. So when you say 30, you say 1 cycle complete. 30 compressions and 2 breath have been delivered. So he knows that 1 is complete, the next is second, and 5 compressions like this cycles need to be given. After every 30 compressions, you give 2 breaths. As soon as an AED electrical device is available, start using it, because that will prompt you to say whether the rhythm that the heart has now is shockable or not. One very important thing here to note is that when you have delivered the shock, immediately resume high quality CPR. So minimize interruptions, as I said again and again. Now, this is an automated external device which you will find at most of the airports in the glass case and in many railway stations as well. So what you must avoid, please understand, do not be a rocker, do not be a bouncer, do not be a bender, do not be a double crosser, do not be a massager, and do not be a sitter. So these are the positions which you must avoid. Like I said, the heel of the dominant hand should be on the chest and the other non-dominant hand should be holding it. No part will touch, and your elbows are absolutely straight, and you are leaning on the patient and thrusting hard with the shoulders. So here you get the thrust from the shoulders. Remember, do not bend your elbows. The thrust will be lost. So ineffective CPR often occurs because we are rockers, benders, and bouncers. So avoid these situations. So let me give you another video. Acha, opening airways. So when you open airways, what do? As I said, a single rescuer, mouth to mouth or through a barrier mask. If you have a bag mask, breaths can be given there also. If there are 2 rescuers, you're very fortunate, because then another person will be giving you the breathing. So head tilt and chin lift and thereafter pinch the nose so that you don't lose whatever you are pushing in, and push through the mouth, 2 breaths, and again resume 30 compressions post that. So every 5 30:2 cycle, the 2 rescuers will change their places. The person who is giving the breathing has not tired as yet, so he will go and do the compressions, and the person who was giving the compressions will now go to the head end and give the breathing. So once you are done that, what is the ratio I've told you? There's a little difference between children and the adults. As I said, universally for adults, we do 30:2 chest compressions and rescue breathing. Whereas in children and in infants, what do we do? 15:2 compressions and your breathings. So just have a look at this. I don't know what's happened to the sound. You can see the positions. So she is now compressing in the right technique. See, her elbows are straight. Her legs are at right angles. The knee is at right angle. And the other person is holding the head tilt chin lift position. So once he says it's 30, he's delivering 2 breaths.
लखनऊ से जाना हमें बड़ा खूबसूरत ट्रेनिंग का सब नहीं है वही ट्रेनिंग
So as soon as the rescuer 1 starts compression, rescuer 2 will say, push hard, push fast, you're doing fine. So it's a moral boost and it's an agon procedure. You need to do it and you need to do it. So less tiring for the person who is doing the compressions. In India, like we say, Jai Mata Di, and everybody goes climbing up the stairs, up the hill. It's something like that. You keep on saying, push hard, you're doing so good, push fast. So encouragement at every step is needed by everyone. When you do a child CPR, from the age of 1 year to puberty, how do we determine puberty? Just like that, if there's a child in front of us. So puberty means in males, there should be chest or underarm hair. And for any female, there should be a little bit of breast development. So before puberty, that is 1 year to puberty, I'm not talking about infants as yet. You do a pulse check. If it is a younger child, you go for the femorals or the carotids or the brachial. And if it is a older child, you go for the carotids and the femorals. So again, for children, as I told you, the ratio of compression and ventilation is a little different. It is half. So it is 15 compressions is to 2 rescue breaths. And the compression technique can be done by simply one hand. You don't need to have the other hand, or you can have a finger one in the infants, or you can have a 2-hand technique as well. So the compression depth again is a little lesser, maybe about 2 inches in the anteroposterior diameter or about 5 centimeters. In adults, I said we go deeper in between 5 to 6 centimeters. So for infant age below 12 months, excluding newborns, the labor room is entirely different. For the infants less than 1 year, we do a brachial pulse checkup. So when we do a brachial pulse checkup, the technique of, again, the compression can be 2 finger as shown over here, or it can be you circle the whole thing by a 2 thumb encircling technique, holding as if you are holding a lemon or something in your hand, and then you put 1 thumb over the other, and then you like squeeze it with both your hands. And behind holds the baby, and you're squeezing it. So the diameter goes to 4 centimeters to 5 centimeters. The ventilation ratio, again, as I said, is 15:2. So having said that, Just have a look at this video. This person is doing a infant BLS. So what is he doing? He's checking for response. Baby, are you okay? Now look, listen, and feel. So he's activated the AED, and now head tilt, chin lift, and he is doing a 2-finger technique. Counting out loud, 13, 15. And now you see how he is giving the breath. He is holding the mouth and the nose in the mask, or you can hold both the nose and the mouth in your mouth and deliver the, like this, you will have to do 5 cycles. So this is another difference between an adult and an infant. For the adult, you pinch the nose and you deliver the breaths on the mouth. For an infant, both nose and mouth in your mouth together, and you deliver the breath through both the orifices. Now, AED is available at every public place. So, AED is almost like a defibrillator that you have at your office, but it improves the survival rate in certain cardiac arrest. This is portable and can identify an abnormal cardiac rhythm when needs shock. So, prompts the providers for advising whether shock is needed or not. These AEDs, once they are applied, they will talk to you and they say, shock needed, shock given. So things like that, they will actually communicate to you. As prompted by the AED, you can deliver the shock, and then at that point of time, you have had 5 cycles already done. You can switch positions with your partner if there are 2 rescuers. So minimize interruptions, therefore, will help. Now coming to another very, very important aspect, that is choking. So when you say choking, that means there is a universal sign. Like this, he holds his neck. So that is a universal sign of choking. If in the restaurant, if in your college canteen, you see somebody like this suddenly going while eating, that means he is choking. So if he cannot breathe or has increased respiratory, trying to cough, so that and cannot talk, the block is severe. So if that be so, ask the victim, are you choking? Like for the victim where you gave BLS, you ask, are you okay? Are you okay, child? Yeah, uncle, are you okay? Similarly here too, you need to ask. If he says, if he's coughing, do not interfere, because that is the body's normal mechanism to take out the object. So do not interfere there. So, however, if he is choking there is a maneuver called the Heimlich's maneuver. So, how is this Heimlich's maneuver done? First and foremost, you move behind the person. So, once you are behind the person, you can do even this for a pregnant lady. You can do this for an adolescent. So, no issues or no worries about delivering a Heimlich's maneuver. So, wrap your arms below the armpits and wrap it around the victim. And once you have done that, make a fist with one hand. Fist with the thumb inside. So thumb goes inside, you've made a fist. And then with this thumb, which part of the thumb? This part of the thumb where the thumb wrist, this part of the fist where the thumb is inside, you place this. Where do you place this? Just see, below the, just above the navel, along the sternal line. So once you have placed it over there, you above the belly button, below the breastbone. Remember, please try to be below the breastbone or else you'll fracture the breastbone. So then you quickly, you've done this and you grasp this hand with the other hand and give a quick upwards and inwards pressure. So once you've given a thrust into the belly, you do repeated thrusts until the foreign body comes out, or the victim falls down unconscious and unresponsive. Once he is unresponsive, what do? You start BLS. You just learned how to do the BLS. So let me show you this also. Just see the position. I know the sound is not coming, but look at what is happening. So this is a college canteen where people are having, doctors like you are having food. And suddenly when he comes back and talks to his friend, he observed that on another table, he observes that on another table, there's a boy eating, and there he goes. There's a universal sign of choking. So he's choking now, he's choking. And so now he goes, he wraps his hands and then gives upward and outward thrust, and the boy is relieved. So if you find that the person is relieved, then you can ask him whether he's all right, or you can take him to the hospital thereafter, but be happy that you have saved a life. So choking is also common in infants. You've seen many of the infants choke on peas or choke on peanuts or on matar dana and things of that kind. So choking is common, and in severe choking, the risk of mortality, especially in infants, is very, very high, because removing the object from the infant's airway will require a combination of efforts, and that is back slaps. So what have you done? You kneel so that the infant, take the infant on your lap, and look at this position, what is happening. The lower hand is on your thigh, kneeling with the lower hand, a lower end of the baby, the anterior part of the baby on your lower arm is resting on your thighs so that you don't push it away. You're getting a firm surface, like I said. The head is in a lower position than the body, and the other hand is slapping the baby downwards and outwards in the intrascapular area. So here you see what is happening is that the baby is face down, head slightly lower than the chest, resting on the forearm. And how are you supporting the baby? You are supporting the baby with 2 fingers in the mouth, and you are holding the chin down so that the baby supported at the neck and does not slip down. So chest and mouth. There you support, and then you deliver 5 back slaps forcefully. Use the heel of one hand again. No part of the hand touches except the heel of your hand. So this will help to dislodge. Now, once you've done that, what you do is you just hold the baby and turn him onto the other side. So this is a technique which you will have to do actually on hands and master this technique. So back slaps followed by chest thrusts. What are you doing? You are now having the head down, but the infant is facing you, and you are using 2 fingers like CPR. You are giving inwards and upward thrust, supporting the infant, and the infant's face is up, head is lower down than the trunk. And similarly to those 5 back slaps, you have given 5 chest thrusts. After doing 5 cycles again, look into the mouth of the child. Okay. So once you look, you can see a foreign object. Do not try to put your fingers in and try to dislodge it. And instead, what will happen? It will lodge deeper in. So if you have a pincer, you can take it out, or else you can take the child to the hospital. So partially blocked, the child is still respiring. If you try to dislodge it by your fingers, by just doing this, then you will actually, instead of a partial block, land up into a full block. So just watch the technique over here. So you see how it is done, choking part of it for a infant. So don't panic, never panic. If you panic, you lose your mind. And don't intervene when the victim is coughing. Don't perform blind finger sweeps in the oral cavity of infants and children. This will cause a partial block to become a full-fledged block, and the child will suffocate and die. If the victim becomes unresponsive at any point of time, stop your efforts, lay him down, and begin CPR or BLS. So we have this standard treatment guidelines also. You can refer to these. Thank you so much. If any of you are interested, we have a EBLS Foundation course, which you can go through. I will post on your WhatsApp. And we have CPR courses for everyone, be it layman, be it the medical students, be it the nurses. So we have the IAP, ALS, BLS courses. And if you enter into the IAP, ALS, BLS.com, you will be able to see the courses available and even book if you want to. Thank you so much for listening to me. And I really am thankful for all of you that you shared with me the platform today. Any questions, I will be gladly there to answer. Thank you so much.
Yes, we are open for questions now. You can either unmute yourselves or post the question in chat box, whichever is convenient to you. So, yeah.
Either
there
I've
are
taught them too good or I haven't taught them at all. There seem to be no questions at all.
No, ma'am, it was indeed a very good presentation. You've covered almost all the important aspects that had to be covered, and we are grateful for you. And now, moving ahead in our program, I would like to now invite Mr. Yashwan, who's a non-medico, but the youth ambassador who's representing India at the International Adolescent Health Week, to give his perspectives on this BLS training program. Yashwant, over to you.
Thank you for the introduction, Dr. Sanath. Hello, everyone. Namaste, Dr. Piali, ma'am. The session was very informative, and I think it was beyond my expectation. I got to know about what a basic life support is and why it is very important for each one of us to practice so that we can save lives, which is a very good thing. And as you mentioned earlier, we could have saved many leaders like Dr. APJ Abdul Kalam, if anyone around them knew how to do the basic life support. So yeah, it was a very good session, and I feel really grateful for being around the doctors from all over the nation. So I feel very privileged to share the space with you, ma'am. Thank you.
Thank you so much, Yashwant. Now, I would like to hand over it to Dr. Preeti, ma'am, to give her words about this session.
Thank you very much, Sanath. It was a wonderful session, Piali. Piali, I have a few questions. Nobody's asking, so I must
Free
take this
to ask, free to ask.
opportunity to ask. So, you said that when there were two rescuers, 30:2, right? If there was only one, then what do we do that time?
So for adults, again, it is 30:2. It is universally, initially it used to be 15:2 for two rescuers and 30:2 for a single rescuer. But now universally the 2020 guidelines say 30:2 universally, whether it be a single one or whether it be two rescuer.
Okay. And the same holds good 15:2 for children.
For children, yes.
Yes. Single or two. Okay. And sometimes people will say, oh, she choked over this half an hour ago, And do we still do the maneuver then, or do we give it a chance to do the maneuver, or we just is there a time limit?
Yeah, so that's a brilliant question. Actually, if you have witnessed an arrest right in front of you, You start your compressions first and you ask some bystander to intimate and get help. But if it's been some time now, you intimate first and then start. The sequence of event changes a little. So because it's an immediate bystander arrest, there are more chances of saving the person. So you immediately get to task.
Okay, okay. Thank you. And does anybody have any other questions? Would anybody like to ask anything before? Okay, somebody's asked her, ma'am, how long should we carry CPR?
As long as it takes, you cannot abandon any patient. You need to transport to a hospital as soon as 108 responds and comes and picks up the victim. The para medicos over there, they will take over and they will continue CPR till the patient is either revived or hooked onto a ventilator.
Okay, okay.
Madam, but always we don't have this mask and everything present with us. So is that mouth-to-mouth ventilation always secure and safe enough to be done in all the
No,
situations?
not in this COVID era. It's not safe. That is why I said use a gauze piece or your own kerchief or something that you place over the mask, over the victim's face, and then give mouth to mouth. But remember, for adults to pinch the nose and then give mouth to mouth, otherwise your efforts will be wasted.
Yes, ma'am. Thank you very much. It was a very wonderful presentation, ma'am. And I would really thank you very much for that. And ma'am, are you going to teach about advanced life support also?
That's for the organizers. You know, Sanath had approached me for BLS. So he is the mastermind behind all this.
Okay,
Madam,
we are expecting that also,
we
ma'am.
will be very happy if you teach us that also. We will be very happy. And our WPF platform is always in support for this such type of
Thank you,
things.
Sangita.
So
Thank you.
yeah.
We'll keep it in mind.
Yeah, please, ma'am.
Another question, Piali. After how many rounds of CPR should we recheck for pulse?
Okay. As I said, minimum interruptions. So if you lose precious time rechecking pulse each time, you've had it. So not more than 10 seconds should be lost. You can do it after 5 rotations when you are changing, maybe once you put your hand on the carotid or the femoral. But it would be better if you can strap a stethoscope to the chest and listen to the stethoscope instead of repeatedly doing a pulse check.
Okay.
So we'll know correctly when the heart rate is going down. And once below 100, red flag absolutely. Below 60, you are at risk.
Okay. Another question that I was having in mind, Dr. Piali, was suppose it's a road traffic accident, you know. So at that situation, and there is, somebody who's not breathing, and we feel it's an arrest. What do we do at that situation? Will we do the same thing, or do we need to do something extra?
Yeah, Preeti, we need to do a little extra, like supporting the neck and the spine, because the person has been hit by an automobile. There is every chance that the child has had a cervical neck injury or a spinal injury or some fracture. So one first thing, as I said, is scene safety. You don't stand right in the middle of the road. But I remember there were a few people who had helped me once that had occurred in the middle of the road. I could not shift the patient because I had nothing at hand to actually give support to the neck and the back. So there was no plank available. It was deserted and there were a few vehicles which were plying. So what we did, scene safety, I just put my hand out and there were so many good Samaritans who came in and they made a line of automobiles on the road blocking the traffic from both sides so that I was not hit. And then I could give some amount of BLS and we called 108 and the ambulance surprisingly came in fast and the patient was transported. So if you can have a towel or even a gamcha, which we use mostly, a villager passing by, you can ask for support. You can just wrap it around the neck. If you have a wooden board, you can 1, 2, and 3 put the child or the person on the board together. You can pass a sheet underneath him and as a whole, you can lift him up. So those are the precautions that you need to take. Otherwise, if there is a partial rupture of the spinal cord, you can cause a full compression and you can choke the child or the person.
Thank you, Pyali, for emphasizing how
just
important the stabilization. Yes, go ahead, Sangita. Go ahead, then Yashwant wants to ask a question after you.
yeah, just once I was going from Mumbai to Delhi, and one couple was there, and one Arabian was there. He just got choked, and that time I have given him life support. So I have wrote a poem during that my flight. So I just want to read that poem. Can I? Yeah. I won the game of life. He might be a billionaire, but that time I was feeling privileged that God had given me the power to give him life. I was the hero. I am the hero. Yes, I saw society. His pulse was downing. His lips was blenching. His eyes was staring at me, asking for life. His breathing was slowing. He was begging. Someone called, help, help. Yes, I was there in the flight. My mission was to attend my NCT project task force. So I was on the way to Delhi flight. But it was his call. The Almighty made me the source to save him. Indigo flight with best first aid facilities. I treat him, the Almighty guiding me. My 4 years journey of medical education made me to become the only source to help him. After half an hour of difficult attempt to save him, a voice came from his gut. Oh, feeling better now. And my neck was high up, feeling proud I could save again one more life. That too in a very difficult situation when flight was flying high in the sky is there to help all. He, the Almighty, made me his saver. Feeling proud of my profession, the best profession of the world. हम मौत से खेलते हैं, हम जिंदगी को भी मात दे सकते हैं. हाँ, हम डॉक्टर हैं. My face was a big hug from her, from the unknown Arabian wife of that fellow who was saying thanks in her Arabic language to save her husband. Amen. So it was very thrilling experience that time. So I thought better to share here.
That's nice. That's nice. Sangita, Yashwant, would you like to say something and ask a question? Wonderful,
Such a
Sangita.
wonderful poem, Dr. Sangita, ma'am. Ma'am, my question is, can we perform CPR on pregnant women?
Yes, Yashwant, as I said, Heimlich CPR, everything can be done on pregnant woman, but you don't do it on the abdomen, you do it on the chest. Okay, so a little higher up. Okay, and somebody has also asked whether if the person vomits, what do we do? So you can lay the person on the side, let it drip out, or if you have a handkerchief or a gauze piece, you can just clean up the mouth, head tilt and chin lift, and then start your CPR again. So once you do sideways, it rules out, or if you have a kerchief, you just wrap it around your finger and you remove the secretions, and then head tilt and chin lift, and then you start again the breath and CPR. So that way you save a life even if the person vomits.
Anybody else? Anybody else? Okay, so should we wind up, Sanat?
Yes, ma'am.
Okay,
Yeah.
okay. So should I give the vote of thanks on behalf of WPF, and then I'll give it, I'll
Sure,
give it.
ma'am.
Okay.
Sure.
Okay. So thank you so much, Dr. Pyali Bhattacharya. She's such a vibrant member of the Women's Pediatrician Forum, and we are so proud of her. It was such a wonderful session. And as somebody said about advanced life support, we look forward to many such sessions with the IFMS, and we'll be very happy to do that and work in partnership, not only for CPR, but for other things where we go out into the community itself and do work there together. Thank you so much. And I must mention that you have such a brilliant organization and you have so many shining stars in your organization. To name a few, the founder, Dr. Saud Khan, and Dr. Saima, the president, Siras Datta, the vice president, of course, Sanat himself, and the core secretaries, Aditya Rao, Priyansha Chawla, and Harshin Kaur. Thank you so much for collaborating with us on behalf of WPF and the Organizing Committee of International Adolescent Health Week. And of course, our chairperson, Dr. Sangita Lodha, is here. We extend a very, very heartfelt gratitude to
Thank
her
you.
for making sure that this International Adolescent Health Week was a big hit. We really, really thank her for giving us this platform, for adding so much value to our program. Thank you very much, Dr. Sangita, and to all my colleagues at WPF, some of them who were here and some of them who couldn't make it, but we make sure everybody sees this program by uploading it on YouTube. So I also tell IFMS to be sharing a link. I know you have a fantastic Insta page, and also Yashwan, please share on your Insta page as well, and we shall make this viral. Thank you so much, and over to you, Sanat.
Yeah, so before I give my vote of thanks, I want to tell you why BLS is very personal to me. It's for two reasons. I was fortunate enough to have undergone AHA certification for BLS and ACLS as part of my USMLE journey. And it was quite surprising and happy to see that I was part of this BLS program with a cardiothoracic surgeon, a nephrologist, and an anesthesiologist who had to take this exam for their Dubai entry. But surprisingly, the most number of questions was asked by the cardiothoracic surgeon. I mean, I was very happy. I was very happy to see the enthusiasm. He was 55 years old, and but his enthusiasm and the kind of questions he asked particularly surprised me. And I told this to my dad as well, who's not from a medical background, and I told him how important it was, and I kind of explained to him a few techniques as well. But the second thing that is why BLS is important to me is because I had planned this BLS webinar well in advance, but 3 weeks back I entered US, and of course India and US timing don't sync, and I was sleeping. I had about 10 to 15 missed calls. We lost our aunt due to massive heart attack. But yeah, my dad tried to contact me. I mean, I still have this guilt that if my phone was on, I could have at least guided them through something, if not anything. But my dad, I know we were not lucky, but I'm proud that I could pass on this message of CPR to my father, and he guided my cousins over there in Pune. We lost my aunt in Pune. I mean, it was all three of our vessels were flooded, so probably nothing. Something could have been done, but yeah, that is why BLS is very personal to me, and. Yeah, I hope I can collaborate with ma'am and spread this awareness, and probably we can save more lives and our dear ones as well. So moving on to our vote of thanks. I would like to thank Dr. Piyali Bhattacharya ma'am for taking time out of her busy schedule to share valuable insights on this essential topic of BLS. As the saying goes, good CPR is better than bad CPR, but even a bad CPR is a million times better than no CPR at all. Before the new CBME curriculum, CPR training was particularly limited to only internships and house surgeons, leaving medical students as unprepared as the general public in emergencies. But webinars like this equip us with the right techniques, and I believe that everyone who's attended the webinar will step up during emergency, because learning is one thing and stepping up in emergency is the most important thing. So I hope everybody does that after learning right techniques, and it is important to apply in real life as well. And now I'd also like to thank Dr. Preeti ma'am for her constant support, and Dr. Sangita Lodha ma'am for handling the tech setup and making sure that we have a recording. And lastly, I would like to thank Dr. Saad Khan, Cyrus Datta, the design team and the social media team, and the entire national team of IFMS for their efforts in making this event possible. We would like to collaborate more with you, ma'am. And yeah, I'll be particularly happy to see the enthusiasm, comments like this, that we want ACLS. This is what drives us forward to do more things. And yeah, BLS shall remain very personal to me, and I hope I can bring a difference in the world. And hopefully I'll be able to save more lives. Thank you so much.
Can everybody have the camera on? We'll take a picture.
Yes, ma'am.
Yes. Pallavi will help us in this. Can we have everybody's camera on? We want to see your wonderful faces. Yes, thank you, Rehan. Thank you, yeah, Rajal. Dani sir, thank you for being there. And thank you for putting your camera on. Everybody, yeah, Gayatri, thanks. Thanks, Khushi. Thanks, Sudhakar sir. Thank you for coming, being there. Yeah, Itika, Jwalita. Please have your camera on. Yes.
Preeti, I'm so privileged. There are seniors here.
Yes.
I said I'm so privileged. There are seniors here who have come to, look at the passion. They've come to learn again.
Yes, definitely. So we all work together and collaborate together. That's the wonderful thing about medicine. You're always a student for life.
Yeah.
We remain young always. Yes, the wonderful about medicine. Yes. Yeah. Okay. We can have a picture. Dani sir, put your camera on. We want to see you. Yes, sir. Thank you. Yes.
Learning is never ending, madam.
Definitely, sir. Thank you, sir. Yes.
We'll be learning until we breathe.
Yes. Pallavi, is it you taken a picture? Sangita madam?
Yes, I've taken. Yes.
So it's time to say goodbye, Sanat.
Yes,
And
yes.
Now,
And
Piali ma'am, you give us time for advanced life support training program. You give time and we will manage it.
Okay.
And that time we will just start campaigning from 2 months or 1 month prior.
Okay, give Sanat time to come back from USA and then we will plan it. Poor
Yes,
chap
yes.
was
Yes,
sleeping and
Yes.
we just woke him up. I think, what time would it be, Sanat, in US?
No, it's 4 a.m. I just returned.
Look at
Our
that.
attendant was on call. I came back at 2 o'clock. It's 4. No, it's off today, so that's not a worry.
So
I'll
good,
sleep.
so good. 4 a.m. and you are up and about and conducting the program. That is laudable, absolutely. So when are you back?
I'll be back in December, ma'am. December 16th.
So then, Sangita, we can plan it once he's back. And I'll be more than privileged and happy to do another program with such lovely people.
Sure.
Thank you so much, ma'am.
Thank you.
Thank
It's
you,
an
Bye-bye.
honor to have you here.
Bye-bye.
Thank you.
Bye-bye.
Bye.
Yashwant, this was good to see you. And Sanat, thank you again. And
Thank you, ma'am.
Sangita, my
Pleasure
friend, and Preeti, my friend, both of you, thank you so much for inviting me for the session. It was lovely to have been with you all. Thank you. Bye-bye.
Thank you. Bye-bye. Have
Thank
a
you, ma'am.
wonderful Sunday. Bye.
Yeah. Thank you.